Let's spend a moment looking closer at a syringe. A syringe consists of a needle, which we've already talked about tightening and pulling off the cap, the barrel, and the plunger, which moves up and down, and that's where the medication is drawn up and administered. On the side of the barrel of the syringe are markings in pharmaceutical terms that show how much of the medication needs to be drawn up. So you may not be familiar with this, and it will be consistent with the dose that your doctor prescribes. So if your doctor said take half an ml, that's really at the 0.5 mark. Now notice how when I pull back to that marking, I am lining up the bottom of the plunger that's closest to the needle. So let me pull it back a little more, and now I'm at the 1 ml mark. The doctor may prescribe the medicine in mLs or cc's, and you could probably clarify it also with the pharmacist if you're not sure. I just want to do a quick demonstration to show you one of the techniques we also use. You pull back the amount of air you're going to put into the syringe. You inject the air into the bottle, and then you pull back the medication that you're going to take. And just to let you know, sometimes the syringe will fill okay. Sometimes you need to pull it back to the marking of the actual medication. You also want to flick out any air bubbles. And the reason for that is not because air bubbles are particularly dangerous, but because they displace the medication. If the medication you're going to inject is testosterone, you can use the same instructions for the vitamin B12 injection. The main difference is testosterone is very, very viscous, which means it will be a little bit more resistant when you try to draw the medication out of the bottle and also when you inject the medication. So I just want to show you briefly, sometimes we use a larger needle to draw the medication out. And then what you can do once the medication is in is switch on a smaller needle. But remember, however you do it, it will be, with the smaller needle, a little bit more resistant when you try to push it in the muscle. So I'm just going to draw some up to show you some of the techniques you may have to use when drawing up testosterone. The technique for drawing up the testosterone is almost the same as the B12, and I'm going to demonstrate it for you. You draw up the air the same way you do the B12 in the same amount of the dose you're going to give. And here it's half a cc, and notice that again I'm lining up the bottom of the plunger with the numeral on the barrel. Then you clean your bottle and inject the testosterone into the bottle. There's both multi-dose bottles and single-dose bottles. And with the needle within the solution, you're going to be pulling back on it. Now this is a large needle, so it's filling pretty easily. And what I'm going to do is push it back to the exact dose that I'm prescribed.